Well, good morning, everybody. It's Dr. Bruce Guillory. I'm with Health Source of Atascocita. Today is Thursday, November 30th. It's the last day of November of 2017. Really hard to imagine that we're getting into the last 30 or so days of the year 2017. We'll be staring at New Year's Eve and New Year's Day here shortly. Kind of crazy. Hope you guys have had a great Thanksgiving. Hope your week has gone well. It's beautiful out here in Southeast Texas this time of year, and I hope you're getting a chance to get out and enjoy some of that weather. I want to touch base with you on something that came across my brain yesterday. I had a conversation with a young patient of mine, a sweetheart of a patient that I've known since she was probably 15 or so. She had her wisdom teeth removed. She's in her early 20s now, and she had her wisdom teeth removed. And the doctor prescribed for her multiple medications, one of which is an antibiotic, which is needed and necessary, get that, but one of which was hydrocodone. Hydrocodone is one of the most common opioids prescribed in situations like that. And she said to me, Dr. Guillory, look, I don't understand why I'm taking this because it's really not doing me any good. So I began to have this conversation with her. I said, you know what, friend? The truth of the matter is, between 1999 and 2014, a period of 15 years, the amount of opioids prescribed in our country quadrupled. 4 times, quadrupled, okay? So it was 4 times the amount of prescriptions in those 15 years. And the amount of reported pain levels by patients that are prescribed these medications did not decrease at all. What? They were prescribed highly addictive medications with tons of horrible side effects. I don't know if you've ever taken any sort of opioid drug, but they're rough on you, and they're getting no reduction in pain. So I told her it's really not uncommon for people to take these pills and not see any results from them. So she said, should I keep taking them? I said, look, I can't really tell you that, but you need to ask yourself a question. If you're putting a drug in your body that has all these potential side effects and is highly addictive, and I spat out some stats like 80% of all heroin users started by abusing prescription opioids. I spat those stats out to her. I said, if you're taking something like that and it's doing you no good, why would you want to keep taking it? And she says, I don't. I said, that's your call, and that's probably a smart call. Guys, it's crazy. It's absolutely crazy how often these things are being prescribed. Unfortunately, there's a lot of financial gain for some physicians to actually be prescribing them, and that plays into the game also, and that's a really sad state of affairs. You know, like I said, 80% of all people who use heroin started with prescription opioids. If you're on a 30-day supply of hydrocodone or some other opioid, your increase of addiction has increased by 30%. I mean, that's just absolutely insane in my opinion. That should not be happening. You know, and one of the largest reasons that people get prescribed opioids is back pain. And, you know, the CDC has come out. No, I'm sorry. The FDA came out, and I believe it was the American College of Physicians came out this year, both of them saying that for back pain, do not go the direction of opioids. Try things like chiropractic. Try things like massage therapy. We have that available too. Try things like acupuncture. So even major organizations like the FDA and the American College of Physicians are realizing opioids are not the way to go, that are a very dangerous direction to go when it comes to dealing with back pain. And chiropractic is one of the best things for it of all that's out there that has no negative side effects for the most part. So anyway, Health Source across the nation has decided to continue this program that we've been doing for the past almost 60 days. And so we're going to continue it through the end of the year. And it's a situation where we're going to help the Salvation Army. The Salvation Army runs about 130 or so addiction treatment centers across the country. And from now until December 31st of this year, if you come into our office as a new patient, you can make a $20 donation to the Salvation Army, and we will get you a complimentary consultation, a complimentary examination, and a free 10-minute chair massage in our office. It's a heck of a deal. So if you're dealing with pain, or you know someone who's dealing with pain, you need to get yourself to a Health Source office. You can call us directly at 281-852-5600, or you can actually go on the website of healthsourcechiro.com, and you can search for a Health Source office near you. We're doing our best to fight back against this opioid addiction crisis that we have in our country. We're doing our best to save lives because, you know, we lose 50,000 people a year to deaths from opioid overdoses. Nothing to fool around with, folks. Health Source is all about saving lives, changing lives. So if you're having back pain, you're having neck pain, or someone you love is, please get them in touch with a Health Source chiropractor or some other chiropractor if you don't have one of those near you. Feel free to contact me if you have any questions. Again, at 281-852-5600. Want to wish you guys a great end of the week. Hope you get to enjoy this awesome weather we're having here in Southeast Texas, and we'll be speaking to you again real soon.